sewing blade. Alright everybody, it's a beautiful night to save lives. Okay, technically I'm not in an operating room. I'm in my kitchen standing in front of the $20 suturing kit I got off of Amazon, but the energy's the same. Your favorite medical shows like Grey's Anatomy and The Pit make suturing look like a dramatic art, but I'm here to unveil the science of biology and engineering to make sure that sutures actually work. When the skin is cut, the body loses tensile strength. The collagen fibers and structural connective tissue are disrupted. Immediately after injury, the wound edges can't support normal stress, and without help, a cut may gape or reopen. To heal itself, the body activates the following phases. In hemostasis, the blood vessels constrict, platelets gather, and fibrin clot forms to stop the bleeding. In inflammation, white blood cells like neutrophils and macrophages arrive to clean out bacteria and dead cells. Third is proliferation. Connective tissues called fibroblasts create more collagen to build new tissue, form new blood vessels, and help skin cells cover the wound in a form of a scab. Fourth is maturation. This is where the scar becomes like normal skin, which is the final stage of healing. However, deeper wounds that are in their earlier phases, they're too weak to hold on to their own. So that's where sutures come in handy. The word suture comes from the Latin word sutura, which means a sewn seam. You may often have heard the word stitches alongside sutures, which both words may go interchangeably. It's just important to note that suture refers to the actual medical device, and stitches refer to the technique used by medical professionals when closing a wound. But all sutures can fall under two categories: non-absorbable and absorbable. Absorbable sutures are made from materials that gradually break down inside the body via hydrolysis or enzymatic processes. They are often used for internal tissue closures or layers that heal quickly. This is mostly used by dermatologists or plastic surgeons. Non-absorbable sutures are made of synthetic fibers, nylon, polypropylene, etc. So how do you exactly suture? I'm going to use a silicone practice pad, or if you want, you can use a banana. This is a wound. I'm going to place a simple interrupted stitch, the most common technique for closing skin wounds. I make a bite about 1 centimeter from the wound edge. That's intentional. Sutures anchor in stronger dermal tissue, where collagen density gives better hold. As I bring the sides together and tie the knot, I'm not squeezing the tissue shut, I'm gently approximating it, so edges meet but the blood flow isn't strangled. Too tight and the tissue could die or scar more. Too loose and the wound could reopen. Suturing may look like simple sewing, but it's essential for patient safety and proper healing. Using the right techniques prevents infections and wound openings. So, in medicine, even the smallest sutures can make the big difference.